We begin with this morning's top story. Ebola still raging in West Africa and now threatening the U.S. and other countries. The disease has killed more than 4,000 people, more than half of them in Liberia, with hundreds more in Sierra Leone and Guinea. There have been 8 deaths in Nigeria and 1 in this country. In all, almost 8,400 cases, by far the worst Ebola outbreak in history.
To prevent new cases in the U.S., today the first of 5 airports will begin additional screenings for people arriving from those affected countries. We will get to that in just a bit, but first we go to Dallas, where the family of Thomas Duncan, the man who died of the disease on Wednesday, is demanding answers about his health care. Manuel Bojorquez has more on that. Manuel, good morning.
Good morning. Texas Health Presbyterian Hospital has yet to fully address exactly what led to Duncan's misdiagnosis when he first visited the emergency room here. But the patient's medical records reveal there were red flags. The medical records released by Duncan's family to the Associated Press reportedly show his 103-degree temperature flagged with an exclamation point in the Texas Health Presbyterian record-keeping system. The records also indicate that during Duncan's first visit to the emergency room 2 weeks ago, he said he felt dizzy, had a headache, and abdominal pain so severe he rated them an 8 out of 10. And despite telling a nurse he'd come from West Africa, Duncan was sent home, reportedly with antibiotics and Tylenol. Semendi Lloyd spoke on behalf of Duncan's quarantined girlfriend.
No explanation at all on why they sent him home with 103 degrees. Temperature. If you went to the hospital right now and your temperature was 103 degrees, no doctor will send you home.
Duncan returned 2 days later, this time by ambulance. Texas Health Presbyterian has defended its care of Duncan, but in a statement said, "We have made changes to our intake process as well as other procedures to better screen for all critical indicators of Ebola virus." For Duncan's family, Lloyd said, it's too late.
Well, at the moment, they are in a grieving process, and legal action is probably something that will come later on. But at this moment, they are grieving over the fact that they were not able to give him a decent burial, but had to be cremated the same day of his death.
Cremation is part of strict guidelines to ensure the remains do not contaminate further. Duncan's death has sparked a national awareness about Ebola. An American doctor who contracted the virus working in Liberia and recovered in the U.S. spoke at a Texas university about the lessons learned.
And we need to stop worrying about the irrational and start figuring out how to love our neighbors and how to effectively end this outbreak in West Africa.
Texas officials say they are looking for ways to improve their response, including a faster quarantine of family members who may have been exposed and decontamination of their homes. They do believe their containment efforts are working because so far no new cases have been reported. Vanita?
Manuel Bojorquez in Dallas this morning. Thank you.